concerns this lady, Annie Adams, born in 1940. She had lifelong interest in art and music, but she never painted in her life. In her 40s, she started painting beautiful pictures, which over the time became more and more in photographic details. And at the age of 46, she painted this one. What do you make out of this? It looks like the national flag of various countries hung together, or it's perhaps a tapestry. It is none of them. It is the painting version of the bolero music, because she liked Maurice Ravel's music so much, and in particularly the bolero, that she became obsessed with that, and she painted it. These black lines there, the black ones, these represent the volume of the music, and the other colors represents the different notes. Actually, this has been analyzed in detail, which note, which color means which note, etc. But she did it. But unfortunately, soon after that, she also started having speech problems and also difficulty in using her right hand. And Bruce Miller called this phenomenon transmodal creativity, that the creativity of one person in one domain has been transferred to creativity of another person in another domain. It was musical creativity in Maurice Ravel. It has become artistic creativity in this lady, Annie Adams. And when she saw Bruce Miller, she already had quite severe degree of expressive dysphasia and had an apraxic and dystonic hand. Initial diagnosis was primary progressive aphasia, but in view of the dystonic apraxic hand, the diagnosis was changed to corticobasal degeneration. The interesting thing was her voxel-based morphometry. This is the lateral surface. Here you can see in the left frontotemporal region there is atrophy of the cortical matter. On the coronal section you can see the atrophy. This sulcus has become widened. However, on the other side, in the region of the inferior parietal lobe, there is an increased amount of cortical gray matter. And that, you know, is probably the site of artistic creativity. So this lady, while losing cortex on one side, and that is accounting for the speech defect and the dystonia and the dementia, she is gaining cortex on the other side, giving rise to more artistic creativity. At autopsy, she had almost knife-edge atrophy of the left frontal lobe. And on the coronal cut, you can see that this is the region of the atrophy here. But here there is an excess amount of cortical gray matter. You can see. So voxel-based morphometry shows severe atrophy of left inferior frontal convolution and increased gray matter in the right interparietal sulcal area. The clinical diagnosis was primary progressive aphasia, later changed to corticobasal degeneration, and the histology of the brain at autopsy showed tau pathology suggestive of corticobasal degeneration. The link between the two is primary progressive aphasia can result from various types of pathology. One is corticobasal degeneration. Two is frontotemporal dementia. Number three is some cases of Alzheimer's disease. So all these three things can cause primary progressive aphasia. So the link was the basic disease was corticobasal degeneration in this lady who painted the bolero, and the corticobasal degeneration was the basic disease in the person who created the bolero, that is Maurice Ravel. So that's absolutely fascinating and interesting. Now this type of unusual artistic creativity has been described in some children suffering from autism spectrum disorder, and they are called autistic savants. And one case has been written up in great detail, and that's the case of an East European girl settled in America called Nadia. I got interested in dyslexia and the development of unusual artistic creativity. And many of you have seen the film Tare Zameen Par, where there was a young boy with dyslexia and how his life changed completely when he took up artistry. I wrote a commentary on that in the journal, and further wrote a detailed article discussing the possible pathophysiology, why dyslexic patients, why autistic patients, and why patients with frontotemporal dementia develop this kind of unusual artistic creativity. This has been explained, and I'm part of that, is a phenomenon called paradoxical functional facilitation. That means it's the principle of neuronal plasticity. We'll come back to neuronal plasticity. That is proposed by a neurologist from Southampton of Indian origin called Kumar, that if there is a disturbance in one part of the brain, another part of the brain takes over the function of that, or hyperfunctions, as we have discussed, like frontotemporal dementia, or in autism, or in dyslexia. The disorder always there, irrespective of the pathology, in the left frontotemporal region. And so, the right hemisphere, where artistic creativity lies, they took over the function, and they hyperfunctioned in some way. And I called it reverse diastasis. I don't think, psychiatrists present here would know much about diastasis, but diastasis means that if part of the brain is hypofunctioning, another part of the brain in a remote area, which is anatomically connected to that, will also start hypofunctioning, even so atrophy. We have written about it in the past. So that is diastasis, described by von Monaco in the 1800 something. This is reverse diastasis. One part is hyperfunctioning, resulting in hyperfunctioning of another remote area of the brain. So that was the explanation which is popular at the moment. We come to a very different topic from this cognitive neuroscience, and that is the subject of hemispatial neglect. What is hemispatial neglect? Usually occurs with the right hemispheric disease, particularly a stroke. Stop me when you think you are fed up. So you get a right hemispheric disease, you get a left hemiparesis and all these things. But in addition to that, you often get, not always, you often get a neglect for the left side. This neglect may be extra-personal, that if I am lying there and I have got a left hemiparesis, I will totally neglect anybody sitting here, standing here, talking to me from the left side. I'll always turn my head to this side and say, oh yes, 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 but I'll never turn back to it. That is extrapersonal. What is intrapersonal? I will be totally unaware of my left limbs. If you bring my limb up in front of me, what is this hand? Oh, this is somebody else's hand. It's probably my wife's hand. Something like that, I would say. And some people have given names to it. Oh, shut up, Tommy. Don't show in front of me. So you are actually referring to his left upper limb. So this is hemispatial neglect. Now, hemispatial neglect can result from lesions in the interparietal sulcal area, can result from lesion in the superior parietal lobule, the inferior parietal lobule, temporoparietal junction, the medial frontal lobe, the frontal gyrus, and the inferior parietal frontal gyrus. But mostly always in the non-dominant hemisphere. It is also possible to get a right hemispatial neglect. I will show you an example with a left hemispheric disease, but that is uncommon. Now, artists who develop a right hemispheric stroke, there are a number of artists have been described who develop a right hemispheric stroke and have shown hemispatial neglect in their artwork. The most famous of which is this German painter Lovis Godwin, who developed